Hello guys, it's been a while since I posted. I was quite busy, but I'm happy to be back. Today we are continuing our series on the education that we give to pregnant women, and this is to guide our sisters who are doing their licensure, the midwives, to know how to um, like coordinate their thoughts and know what to say so that they don't miss any point when they are giving their education. And so, for today's topic, we are talking about how to educate women on birth preparedness and complication readiness. And so, it's quite the topic is a little bit bulky, and so for most of the student midwives, they try to avoid this topic, but it has been simplified here so that when you are given that task, you would nail it without any challenge. So basically, this task is talking about two things. There are two components of the task that have been merged into one task. So, for instance, the first part is to help your client to prepare for delivery, and the second part is also help them to prepare for emergencies or complications. That's why we have birth preparedness and complication readiness. So the task is two in one. So bear that in mind. So when we look at the first task, which is birth preparedness, we are basically making sure that this woman is prepared for her delivery. So first of all, we want to ask about her EDD, that is her expected date of delivery. That is what you use to prepare, right? Some people when they wait till they are 7 months before they start buying things. So you need to be up to date with your pregnancy. And then you don't assume that she has not prepared. So you ask about what her preparation has been so far, and then depending on what she tells you, then you add more to it. Oh, you can do this or you can do that in addition to all that you have done. And then you assist the client to decide on a facility where she'll deliver. You might assume that because she's coming to ANC, she'll definitely decide deliver at the hospital. But most of them they're like, oh, anytime it comes, wherever it happens, I'll go to a hospital. But what if it doesn't happen where a hospital is? So you need to like reorientate her mind and let her know that she needs to choose, so that in case of any emergency, everybody around her knows that as for this woman, she says when she's labor, take her to this hospital. So you decide with her. Then you discuss support persons. You ask about it. So most often, just as in all the educational videos that I've given, you ask, and depending on what the person tells you, then you add on. So you want to know about support persons, people or a person who would support her while she's in labor, and a person who will take care of her home when she's away. So, especially if she has children, she definitely need somebody to be back home taking care of her kids while she's in labor. So, you need to ask about that and then give in um, relevant answers to her questions. And then you need to talk about her NHI status, her insurance status, to know that is she even aware when it's going to expire. you know some of them just have it and they don't know when it's going to expire. You help her ensure that her insurance is still national health insurance is still valid. If not, then you show her how to go about it to make it valid. And then you also need to educate this woman on the signs and symptoms of labor and what to expect during labor. As I always say, don't assume they don't know anything. So you ask the question, oh madam, do you know what to expect before you can say that you are in labor? And then she tells you, or she knows everything, and then it saves you to plenty talking. But if she doesn't know much, whatever the deficiencies are, then you are going to support her or give her more information. So this is basically what you do to prepare somebody for a birth. Now let's go to the second part, which is preparing for complications. Now, even though you have asked about where she's going to deliver and you have helped her choose a health facility, you need to remind her of the importance of ensuring that she delivers in a hospital where she would have access to skilled professionals, so that she knows that in order to prevent complications and to make her delivery a smooth one, she needs a qualified person to handle her delivery. And so you remind her of that. And then you also tell her about saving money for the delivery and any emergencies. You know that most women have this national health insurance, but not everything is covered under the insurance. So she needs to have some money around, to help her in case there are things that need to be bought that are not covered by the insurance. And then you talk about transport arrangements, who will bring her to the health facility? Does she have access to transportation? Advise her to get one or two commercial drivers around her neighborhood so that she can have a backup. Everything that she has to do in terms of transport arrangement need to be discussed in this task. And then you talk about blood donor or alternative to blood transfusion. So you know the client that you're dealing with. If the person is in favor of blood transfusion, you let her know, because delivery and bleeding is like they are cousins, first cousins. So you need to make arrangement for either blood transfusion or alternative to blood transfusion, depending on who you are dealing with. And then you need to educate the woman on danger signs associated with labor. Remember, you are trying to make her ready for complications, and the first readiness you can be is to cite these complications as early as possible and then nip it in the bud. So basically, you want to educate her on danger signs associated with labor so that she can be prepared when she sees them and promptly seek medical attention. So in conclusion, I'll say that this task is quite simple. Don't let the name scare you. Just educate the woman on how to get prepared for normal delivery and how to get prepared for complication, and that would be it. So please, thank you for your time. You can subscribe, like, comment, and share, especially for those who are yet to do their practical exams. This is an opportunity to go through these videos and psych yourself up and then prepare for it. All the best in your exams. And this is your regular nurse NK. Bye.